Hi everyone, happy Women Wednesday. Hope you're doing well. Today we're going to be talking about PrEP for women or pre-exposure prophylactics for women. This is a daily pill or injectable medication that helps prevent HIV if you were to be exposed to the virus. So please tune on in. We're going to get started momentarily. I'm excited to share more information about this really groundbreaking preventative medication. Welcome Whitman-Walker. They just joined the space. Just going to get them on stage and we'll get started. Hello, Whitman-Walker. Thanks for joining. Cool. So, during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. My name is Jewel, and I use she, hers pronouns, and I work to bring educational Instagram lives to this space with Whitman-Walker's community health team. Today we're going to discuss PrEP for women, so tune on in. So if you are not living with HIV or you identify as an HIV negative person, after getting tested for HIV, of course, it's important to ask about PrEP. PrEP, or pre-exposure prophylaxis, is a daily pill that can prevent HIV and also comes in an injectable form. And according to the CDC, when it's taken every day, the pill can prevent a person's chance of HIV infection that is transmitted through sex by about 99%. You heard that right, about 99%, and can prevent HIV that's transmitted through injection drug use by about 74%. You can learn more about PrEP and decide if it's the right HIV prevention tool for you just by contacting Whitman-Walker's PrEP team at 202-939-7690. Again, that's 202-939-7690. And you can also email prepclinic@whitman-walker.org. Again, that's prepclinic@whitman-walker.org. If you live in the DMV, you can also access PrEP in DC and find a service location near you. So you can visit www.sexualbeing.org if you're a DC resident. If you're a Maryland resident, you can access PrEP by visiting www.marylandhealthconnection.gov. And finally, if you are a Virginia resident, you can access PrEP by visiting vdh.virginia.gov. Again, that's vdh.virginia.gov. So PrEP may be a good HIV prevention tool for you if you have been diagnosed with an STI in the last 6 months. When you are getting tested for STIs, it's important just to get tested for STIs regularly. But if you have an STI, it'll make it more easy for you to get HIV. If you were to have an STI and also get exposed to HIV, so it's important to get tested really regularly. But PrEP may also be a good HIV prevention tool for you if you are sexually active and don't always use insertive or external condoms or other barriers to make sure that you're preventing fluids from coming in contact with you and for preventing fluids from being exchanged between you and your sexual partners. It's also a good tool for you if you are HIV negative and are sexually active, or you have a partner who is living with HIV currently. It's also a really great tool if you are unsure if your partner is HIV positive or living with HIV, or you just don't know what their status is. And PrEP is also a good HIV prevention tool if you identify someone who injects drugs or you're having sex with partners who inject drugs. So these are all reasons why you might consider exploring HIV prevention tools like PrEP. Now, some might ask, how long does PrEP take to become effective? Well, according to DC Health's sexualbeing.org, they share the following information. People who have anal sex need to take PrEP consistently for 7 to 14 days before they have sex, as that's how long it takes to show up in rectal tissue. And then people who have vaginas or front holes who will be having sex vaginally or via their front hole need to take PrEP consistently for 20 days before having sex. Again, because that's how long it takes for the medication to show up in their vaginal tissue and become preventative and help you stay safe during sex. It's also important to get tested. So getting tested for HIV and STIs is the first step in anyone's HIV prevention journey and also your STI prevention journey. And depending on a person's sexual health practices and activity, getting tested every 3 to 6 months can go a really long way in preventing HIV and STIs. Untreated STIs make it easier to become positive after an exposure to HIV, so it's really important to get tested often, especially if you're a very sexually active person. Additionally, PrEP does not prevent against other STIs, so it's important to still use condoms or other barriers to protect yourself from STIs like gonorrhea, chlamydia, and syphilis. And you can also learn about Whitman-Walker Health's testing hours and locations if you visit whitman-walker.org/testing. HIV and STI testing is available by appointment currently at Whitman-Walker's locations, including the Max Robinson Center. That's at 2301 Martin Luther King Jr. Avenue, Southeast in Anacostia, or at Whitman-Walker Health's 14th Street location, which is at 1525 14th Street Northwest near Logan Circle. You can call 202-797-4439 to schedule your testing appointment. And again, just be sure to check the website for the latest hours to make sure that the hours are open for you to come get tested. Now, if you receive a positive HIV test result or you are currently living with HIV, it's important to start treatment for HIV. Talk with your medical provider about your treatment options. As when a person is living with HIV, they can manage their HIV by taking their HIV treatment as prescribed. So that's just following your doctor's recommendations or orders in terms of how often you take your medication. By being on treatment, you decrease the risk of passing HIV on to another person, and this is also known as treatment as prevention. So if you are actively living with HIV and you're taking your medication as prescribed, you're able to help prevent new cases of HIV by staying adherent and taking your medication as directed. You are actively helping to fight this public health epidemic or pandemic of HIV. People living with HIV who take their treatment as prescribed can achieve an undetectable viral load. An undetectable viral load means that there's effectively no risk of a person transmitting HIV sexually to another person. This is also known as U equals U, or undetectable equals untransmittable. It's a really amazing thing that in 2022, this has been achieved by scientists and public health professionals and doctors, as this wasn't the case when the HIV epidemic first kind of hit the health scene in 1981. When an HIV diagnosis was an automatic death sentence. So it's really incredible that we've made this much progress in research and medication to be able to offer treatment that helps you not pass HIV on to another person. So missing treatment will put you at risk of regaining a detectable viral load. So it's super important to take your HIV treatment as prescribed. Again, take it as your doctor directs you to. But also it's important to start treatment. So if you need to start treatment, you can give Whitman-Walker a call at 202-797-4437. Again, that's 202-797-4437. And all you have to say is red carpet. You can literally say, hi, my name is so-and-so, or don't even give your name, but say, hey, I need red carpet services. And they'll know how to support you and how to help you. And so in saying that to your team member, or to one of our team members, they will help you start medication. You can also call us at 202-745-7000 or email appointments@whitman-walker.org to schedule an appointment. And just mention red carpet and our team can help you start HIV treatment. If your community or organization is interested in Whitman-Walker providing mobile health services in your community or your neighborhood, just contact mobilehealth@whitman-walker.org. Again, you can send an email to mobilehealth@whitman-walker.org. You can also access PrEP or PEP or start treatment for HIV with Whitman-Walker Health at our Max Robinson Center at 2301 Martin Luther King Jr. Avenue Southeast, or at Whitman-Walker's 14th Street location at 1525 14th Street Northwest. And for reference, PEP is called post-exposure prophylaxis. So there's PrEP, which we've talked about today, what you take a daily medication that you take that helps prevent you from getting HIV if you were to become exposed to the virus. But post-exposure prophylaxis, or PrEP, is kind of like Plan B. It's a medication that if you believe that you had an exposure to HIV, you would need to take this medication within 72 hours of that exposure, and then you've got a pretty good chance of not becoming HIV positive after that exposure. So it's kind of like your birth control for HIV that prevents HIV, and then your Plan B for HIV, which prevents HIV if you were to come in contact with it after an exposure. But next week, we're going to talk about PEP, more about post-exposure prophylaxis. But thank you all for taking time to learn a little bit more about PrEP. Again, pre-exposure prophylaxis for women. And with that said, before we go, we want to give you a few reminders about COVID-19 and vaccines. If you've already gotten vaccinated, that's amazing. Congratulations. You've taken a really important step to preventing yourself and your loved ones in your community from getting sick. Multiple variants have spread across the world, and it's totally understandable if you want to keep wearing your mask. The vaccine isn't 100% effective at preventing new cases of COVID-19, but it's really effective at keeping you not very sick from COVID, out of the hospital with COVID, and from dying from COVID. So keep staying alert and just be aware of new protocols. The CDC has got some new recommendations out for COVID-19, so definitely visit cdc.gov to keep up with the latest information. And if you have not been vaccinated yet, or you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available. Please give us a call at 202-207-2480 to make your appointment. And if we are out of reach for you, or not nearby for you, or just inaccessible for you, you're a DC resident, you can find more information about COVID vaccines at vaccinate.dc.gov or by calling 1-855-363-0333. If you're a Maryland resident, you can visit covidlink.maryland.gov or call 1-855-634-6829. And if you're a Virginia resident, you can visit vaccinate.virginia.gov or call 1-877-829-4682. And if you have not been vaccinated and you're not looking for a vaccine appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's really important that you consider getting vaccinated, but especially you want to make sure that you're taking precautionary measures for people who are around you and be mindful of wearing your mask and keeping your distance, but especially when you don't know whether the people who are near you have been vaccinated or not. And finally, we're in another public health pandemic right now. Monkeypox is sweeping the world. So DC has recently they've recently expanded their eligibility for monkeypox vaccination. So just visit dchealth.gov and you can look at when you can schedule an appointment for one of their Friday walk-up vaccine clinics. And then also visit, if you're in Virginia or Maryland, visit your local health department website to see what their process for vaccination is. But wishing you all the best, stay alert, and set up those CDC alerts for your email or your Instagram or your Twitter or what have you, just to stay up to date with what's happening in the world. Thank you all for listening. Please follow our Whitman-Walker family at Whitman-Walker on Facebook, Twitter, and Instagram, and our Real Talk DC family at Real Talk DC_, and our No Filter DC family at No Filter DC_. Thanks so much and have a great rest of your day, and happy Women's Wednesday. Bye.